Let's talk about a less common ankle injury. That's an osteochondral lesion of the talus, or an OCD lesion. I'm Dr. David, orthopedic surgeon, sports medicine specialist, and author of the book, That's Gotta Hurt, The Injuries That Changed Sports Forever. I provide education, information, and commentary on all sorts of sports and exercise, injuries, injury treatments, and injury prevention for athletes and active people so that you can stay healthy and perform your best. An osteochondral lesion of the talus is a small cartilage and bony injury in the lower part of the ankle. The talus is the bone under the shin bone, so the lower part of the ankle. And you can typically suffer this injury with a traumatic event, like an inversion event that you get with an ankle sprain. And you can get it on the outside of the bone, that talus on the outside of your ankle, or on the inside of that talus on the medial side of your ankle, depending on what the mechanism of your ankle sprain was. A lot of times, because we assume it's an ankle sprain, a lot of people don't even go to a doctor. They certainly don't get x-rays. We don't even know that it happened. It isn't until people come in 6-8 weeks later wondering why their ankle still hurts and why it's swollen, that we make the diagnosis. But that's one of the things we see, is either lingering pain, lingering swelling, or just a discomfort inside the ankle that just isn't getting better. You go in to see the orthopedic surgeon, they're probably going to get x-rays, and then you can actually see the lesion. Now sometimes they may get an MRI to see if that lesion is just, is intact, is in place, how deep it is, things like that. But a lot of times you might be able to make the diagnosis just by x-ray. Now, the treatment depends on where it is, how deep it is, and is that cartilage on top of the bony crater displaced or not. Surgery can be cast, surgery can be just being on crutches for a period of time, treatment could involve surgery. It really, again, depends on a lot of those factors. So it's really important to find an orthopedic surgeon that treats these kind of problems. If it's surgery, it could involve drilling whole or small holes into that lesion to stimulate blood flow to get it to heal, or it might be involved taking a cylinder of bone and cartilage, either from somewhere in your body or from a donor, a cadaver, to fill in that defect. So a lot of variables there, but the big one is go get your ankle injury checked out, find out what the nature of the problem is so that you can get better as quickly and safely as possible. Have you suffered an osteochondral lesion of the talus or an OCD lesion of the talus? How did you get it? And how did the doctor make the diagnosis? And what treatment options did he or she give you? I'd love to hear your experience. In the comments below this video, leave your experience, leave your thoughts. I'd love to hear them, and honestly, I think people watching all around the world would as well. I can't answer questions that you leave in the comments for legal reasons, but I'd love to hear your experience. Now, I would love to hear the #1 injury challenge you face with your ankle injury or whatever the injury is. So in the description box below this video, the very top link will take you to a page on my website, and you can write all about your injury and your injury challenge. And the point of that, you telling me that, is so that I can learn more about how I can help you better. Be it create certain kinds of videos, or write certain articles, or create courses or programs. So whatever I can do to better help you, the more I know about what you're dealing with, the better I can help. If you like videos like this and you want more information on sports and exercise injuries, injury treatments, and injury prevention, subscribe to my YouTube channel. I record several of these videos every single week, plus every month or so I do an Ask Dr. Geyer live video where you can ask me questions live on YouTube about injuries and injury treatments, and all of that if you click the subscribe button on the upper right corner of the page. Thank you so much for watching. I really hope this was helpful, and I look forward to seeing you right here next time.